the latest enrollment numbers just released from the Obama administration indicating that 106,185 Americans have enrolled in Obamacare, either through a state exchange or healthcare.gov. The number on the federal level, and 36 states use that federal website, healthcare.gov, very, very low, 26,794. Let's get some reaction to these numbers from someone who was an advisor involved with the creation of the Affordable Care Act. Jonathan Gruber is an economics professor at the Massachusetts Institute of Technology, or MIT. He was also behind the Massachusetts healthcare plan, RomneyCare, as you may know. Mr. Gruber, Professor Gruber, these numbers are rather disappointing, I would think. Do you think that the administration is going to be able to get the website up and running enough to make the 7 million enrollee projection needed by the spring?
I don't agree with the characterization as disappointing. I think they're basically meaningless. Look, when we opened our system in Massachusetts, the first month that people could pay premiums and enroll, 123 people enrolled. By the end of the year, it was 36,000. So that meant we got 0.3% of the people the first month. By that standard, the federal government did great. They got 1.3% of the people the first month. So I think that basically, look, it's just too early to say anything useful. The real deadline we have to focus on here is March next year. That's when the individual mandate kicks in. That's when people need to be signed up. And that's what we really saw in Massachusetts was a large rush right before the mandate kicked in.
Okay, good context for us to know. Just for the record, I was saying disappointing because that's what many individuals in the White House have called that number disappointing. Right. But you dispute that, that's fine. As Dana Bash just reported, House Republicans are saying, I told you so. I understand that you disagree, but do you think if you compare what happened in Massachusetts with what's happening right now with Obamacare on a national level, is the website and enrollment, the opportunity to enroll on a federal level or state level with Obamacare, where RomneyCare was at this point? Was the problem back then with the website, with the ability to enroll, or was something else going on with the disappointing numbers initially in the state of Massachusetts, Commonwealth rather, of Massachusetts?
Well, once again, not to pick bones, but I think we didn't think of it as disappointing at the time. We said, look, we've got a year to get this going, and we'll worry about it at the end of the year. But the bottom line is, look, I don't think we have big website problems. I think we had low numbers not because the website didn't work, but because people said, look, the deadline for me to sign up is December 31st. I'll sign up before then. Here, I think people are saying the deadline's March 31st. I'll sign up then. So I think we all wish the website worked better. I think the numbers would be higher if it worked better. But there's really no need to panic. It's just the nature of our political system to make too big a deal out of these numbers.
With all due respect, Professor Gruber, there are millions of individuals whose plans are being canceled right now because they don't meet the standard, what Obamacare mandates these health care plans offer in terms of mental health coverage, in terms of lab tests, in terms of maternity care, et cetera. I understand the argument to make these plans better, but millions of Americans are having their plans canceled, and they're worried about their ability to get health insurance. Doesn't that add and explain at least some of the panic that some Americans might be feeling?
Oh, absolutely. And I don't want to diminish the panic they're feeling. And I think that if the website is not working, as the government says, by the end of November, so these people can't get in plans by January, then there'll have to be some effort by the administration and insurers to give them an extension for a month or two before their plans are canceled to make sure they can get new plans. We don't want to cancel plans on people before the website's available to get new ones. But let's talk about what the website being available means. It doesn't necessarily mean people can do everything they need to on the website. It means they can shop effectively. The important thing for the website is for people to be able to comparison shop across their options. They can then get on the phone and enroll. So I think the main thing is that by the end of November, early December, people need to be able to effectively comparison shop on this website. Otherwise, those cancellations for January, they'll have to find some way to extend them a month or two till the website can be made to work.